Protect our most vulnerable population.
To fill the
Optimum Health, where are they in there? They should be the ones. They should be the ones.
On July 16th, 2013, I watched Governor Susana Martinez field questions from reporters in her fourth floor hallway about her reasons for cutting off all funding for 15 New Mexico behavioral health providers in the name of some mysterious and secret findings from a no-bid HSD commissioned audit. When pressed by one reporter about concerns certain behavioral patients might have about this drastic move and its implications for their own care, she smugly stated, and I'm quoting here, "We are not going to leave people without services." Again, she said, "We are not going to leave people without services." So I have in my hands here yesterday's newspaper. And the headline basically says, this is the Albuquerque Journal North, "Behavioral Health Services Interrupted." Okay. You know, it goes on to say that 27 callers, consumers, many of you here know about that CMS call, behavioral health workers all phoned into CMS this week to register their complaints about fallout from this transition. The article goes on to quote Paul Weeks, a former therapist with Valencia County Counseling in Los Lunas, who said they had lost 9 of its 12 therapists as a result of this cessation of service since the governor went on camera in July, okay? Clearly the governor was wrong. You know, ever since I heard that, and I've been on these committees where we hear HSD explain their actions, and just the way they talk so blithely and confidently about the smoothness of their transition, air quotes, I have been wondering how they could have presented it like that. I mean, why would she make such a public statement? Meaning, obviously, that she and her HSD secretary do not really understand or have a feel for what they oversee here in New Mexico. I mean, as a result, we have stewards and leaders in the executive branch who apparently dimly understand what mental health services are about in this state. You know, otherwise, how could you say that it would be no big deal? That it would be no discernible effect on clients and families, this complete overhaul and outsourcing of our state's behavioral health system. No big deal. That's what they said. They're ignorant. They don't know. They don't know anything. They don't even know what they preside over, obviously. As most of you in this crowd know firsthand, our behavioral health client base is fragile. Their commitment to therapy and their willingness to work with one particular therapist, for example, is tenuous in the best of circumstances. These are so often high needs and vulnerable individuals, young and old. They do not handle change easily. Or the elimination of a local provider that they have come to know and trust. So, now to the learned group up there on the 4th floor, when you say to them, high needs, vulnerable individuals, I'm just not sure really if that registers. I mean, I don't know if they really care or know what you're talking about. I'm just judging on their actions. Truly, we as New Mexicans take care of our own, especially those in need, those who do not fit in or maybe need special services. I know this to be true from my own work in the charitable sector. You know, we have a low per capita income rate in New Mexico, but we best any state with our generosity, and I know that firsthand. We care about our fellow people that are in need. We do. So these 15 providers, They're all rooted in the communities they serve. Alamogordo, Clovis, Tucumcari, Espanola. That is why my legislative colleagues on the other side of the aisle are hearing it, definitely, loud and clear from their angry constituents. Why would the governor do this? Constituents want to know. Why would these community-based companies not be given a chance to at least see the specific charges against them? Does not the governor understand the importance of due process? She's an attorney, right?
Yeah.
Why would she essentially execute these small New Mexico businesses without benefit of any kind of recourse, as my Senate colleague Jerry Ortiz y Pino so eloquently states in committee? It's an execution.
It's
Okay.
about the money.
All right, so we've established that our executive branch dimly understands, at least I think we've established, that they, dimly understand what mental health services are in New Mexico and its delivery. But it goes deeper than that. There's even more ignorance at work here. And this is something that I have come to recently. The learned bunch up there on the fourth floor, I just don't think I don't think they understand what a nonprofit is. I mean, truly. Like why it exists, what it's like to be on a nonprofit board or a staff person, etc. I mean, I can only guess that they are so used to the halls of corporate power, so immersed, soaked in corporate culture, that they do not understand why a behavioral health concern would want or have to do grassroots fundraising like a dinner benefit, silent auction, raffle, golf tournament. This just must be completely alien to their experience. And I suppose at the rate that these Arizona executives are being paid, they are hardly dying to buy a $5 raffle ticket.
Yeah.
There are many other narratives to this issue that other speakers will get to, and I really, didn't mean to go on. This is about as long as I've ever spoken in public before, but it's important. But I can promise you this. As a freshman senator, I am not going to stand by and watch while our New Mexico behavioral health system is put out of business, dismantled, flat out eliminated. I am not going to stand for it. And I'm not just talking about myself. I know that I am not alone here in the Roundhouse. Both Democrats and Republicans share my view. We as legislators have a responsibility to our constituents to undo this damage. The notion that we are somehow powerless in this circumstance is just not true. We're not just some random state agency that the governor can ignore. We are the state legislature. It is an outrage here. If the outrage here is truly bipartisan, then we as state legislators can call ourselves into what's called an extraordinary session. It has been done only once before in our state's history, but we have the language. The bill is all drawn up, ready to go, and it would force HST to restore the funding to these 15 behavioral health concerns, to restore the funding until they can have their day in court, until they can see what the audit says, all right? Until these well-meaning businesses have at least the opportunity to clear their names. This can be done. I urge you to contact your state legislators to press upon them the importance of this matter. Thank you very much.
I stand here alone today. Most of my patients don't have the financial means to come to the Capitol to make their voices be heard. And my former colleagues are afraid to come and speak because they will lose their jobs. This transition has been anything but smooth. How any person from the governor's administration or HSD can publicly declare that this is not a major crisis without being there firsthand to witness it from day to day is beyond my comprehension. There have not been any state officials at the former Southwest Counseling Center in the 2 weeks that I was there for the transition. There is no federal or state oversight being done by HSD, the Governor's Administration, CYFD, or DHI. Additionally, there's not even a start billing date in sight. I was informed at the staff medical meeting. It is now publicly known that this transition was well in the works in 2012. In fact, there was a quote in yesterday's newspaper, Las Cruces Sun News, that it is a, quote, learn as you go. Okay. Well, A, that's unacceptable. But B, people's lives are at risk here. There was plenty of time for these Arizona companies to prepare a proper strategic business plan to take over these community mental health centers. They failed to do this. Very basic elements of a clinical transition were completely overlooked. In my opinion, there is no excuse for these behaviors. The state of New Mexico has successfully set up a healthcare system in southern New Mexico that can be defined as a monopoly. If I want to continue to practice in the Las Cruces area, or southern New Mexico for that matter, to work with my clients that I personally have a therapeutic connection with, I would have to compromise my ethical and clinical quality of patient care, and I refuse to do so. Without billing being provided, how can anyone be sure what services are even taking places in these smoothly transitioned clinics? Who will ultimately hold the governor and HSD accountable for these reckless behaviors that have permanently damaged providers, staff, and clients alike? I think that I've said enough, and as I mentioned, many of my patients couldn't come here today. They are bold and brave, frightened and psychiatrically compromised, but what I want to share with you now is some of the statements that I brought with me from southern New Mexico from the severely and persistently mentally ill there. Quotes, I am dissatisfied with Arizona companies for canceling all of my appointments. They told me to come back 1.5 hours later. I am a disabled person physically. I need to ride the bus. This is very hard for me and inconvenient for people like myself. In the end, this client of mine waited 3.5 hours to see me because she was fearful that she might never get another appointment there. Another quote, my mother has been at the former Southwest Counseling Center for over 20 years. Cutting services and bringing in Arizona companies is ridiculous, and I consider it to be discriminating against this vulnerable group of mentally ill. Please hear our pleas and bring back the old Southwest Counseling Center and other providers. Stop this governor from misusing our taxpayer dollars. Another quote, I need medical services because I'm paranoid and I have schizophrenia. I need my medicines, and I can't wait like I'm having to do. Please bring back my mental health center. Psych NPs aren't always graceful. Quotes, Arizona companies cannot give me my medications and I need them. This transition has been very, very hard. I want all the people in New Mexico to know the truth of how bad this really is for all of us patients and staff. That's from a patient. Quote, since the transition, now let me tell you that this was written 15 days into the transition, I have been unable to even contact anyone that could assist me in making an appointment. I've now been out of my medications for my depression for three weeks now. I'm depressed and almost suicidal. Quotes, I'm writing this because of all of my psych appointments being canceled. I've been put to the side without even being notified or contacted. I am a client, and I shouldn't have to be fighting to see my doctor. Please take my words into consideration. And then just one last quote. I've been a client at Southwest Counseling for over 5 years now. I am scared. I am upset that they did this to us. I don't like to have to change providers. Everything is a lie. I'm not comfortable. Governor, why did you do this to us? This transition has left me without my meds. I don't feel safe, therefore I will go to the hospital. And those are just some of the quotes. All of the letters, and I have many of them, have been distributed to the legislators, and so hopefully we will have some success soon. Thank you all for listening to me today.
I've been a member of NAMI for 30 years. I also have a sister who is severely mentally ill and have advocated for mental health services in the state of New Mexico for far longer than I can imagine. We've been fighting for good care. We've been fighting for quality care and asking for a system of care that really monitors and looks at improving what we have delivered in New Mexico. For people who don't understand mental illness, it is an issue of trust. It's an issue of fear many times. And when that is interrupted, when that care is interrupted, it's not like being a diabetic and going back and getting back on your medication and you're going to start getting better. It takes months, it takes years to get people back on track. During the call yesterday, and I read the Albuquerque Journal, and I was so disheartened to hear HSD say, these are anecdotal stories. These are not anecdotal stories, I'm telling you. We do not take mental illness as not anecdotal.
Yeah.
Mental illness for people who suffer from mental illness is severe. It is scary. I'm getting calls from the families every day. Too many calls to mention. They let me sign a paper so you could release my medical record. I haven't seen anybody. Nobody is providing care. I have a young man who's been walking around with knives in his pocket and, he likes to threaten everybody. Where is his life going to be when people aren't providing him care? And everybody says, oh, let's give him their medical record and they'll get their care. No, that is not the way it works, people. And it's not saying, I brought you these Arizona companies who have all of the answers. They're quality providers. They know how to do it better because you couldn't do it. But nobody is touching the lives of these people. And there are people in New Mexico. And I'm pleading to HSD. Think about what you're doing. Okay, what's going on now? But from this day forward, when are you going to respond to the families who need the care? Because I promise you, with behavioral health, you're not going to see it today. And you're not going to see it in 30 days. But in 60 days, a year from now, the devastation to an individual with mental illness is unconscionable. And guess what? It takes years and years to get them back to that place that they were before. And these are the people that we love, that we've dedicated our lives to serve and to take care of. And don't you dare, Governor, say that we don't care, that we're corrupt, that we don't care, because you are wrong. You are so wrong. We care for them. We love them. And that's the truth for New Mexico.
With all the words that have been shared, the emotion, the truth that has been shared just before I've come up here, I want to say thank you to each of you for taking the initiative, and it takes the fortitude to be here in front of the media, to be in front of those of you who are our advocates and those who work for our communities. Thank you. But let's go down this road again, just for those who may have joined us. There was an audit that was done in February. The results came out. Payment was stopped. And here we are in the aftermath. I was at that meeting in Chama last week for the LFC. The concerns that were raised were based on budget issues. First, HSD came in and said, we need $7 million to help honor these contracts. Then they've come back and asked for a little more than $10 million. The questions asked were, when are you going to come back and say more? When I read those contracts, if you have not had a chance to read them, there's no limit. $300 an hour for a CEO, and yet the complaint, we haven't seen the audit, so we don't really know what they're dinging, what they are saying that our companies, our entities are fraudulent on. $300 an hour? For those of us who know the math and can do the extrapolation, those of us who know math, excuse me, I'll leave it at that. If you do 300 times 40 hours a week, you can figure out how much that goes. But there's no limit in the contract that I read that says you can't bill for 80 hours a week. 100 hours a week. Do the math. 300 times even 80 hours a week, that's a nice chunk of change, isn't it? And yet they're complaining about some of our CEOs who are making close to whatever the amount is. Well, I think there's a little bit of hypocrisy in that. And when you begin to look at this, and it's the numbers game, it's where they're making the argument is that there's the numbers and we're doing this and that, but we don't even know as legislators, we have asked to see what is going on with the audit. The LFC also had the report that said in there specifically, process was not followed. The process that New Mexico has always followed with regards to audits was not followed. So it's kind of like somewhere in the cloud, as we say, right? What angers me from the phone calls I have been getting from my constituents in my South Valley, these are families who've gone to Hogares for many a time over that now have no place to go. The transition is not working. I don't think it's going to work, period. Because what they are doing right now is looking for what fills the pocket. There is no commitment to the state of New Mexico. If you go back and look at the information on these companies, they all had issues back in the neighboring state over there. And now they're coming here to take care of our people. My constituents have been calling. I've met with them personally over coffee with moms and dads, even some of those young people who are having opportunities taken away from them. They don't know where to go. And when you have a hopeless group of people that are so central to all of our lives, because nobody is a throwaway. No one is a throwaway in our state. But when you have that hope taken away, and hope means the relationship that Patsy was sharing with, that Gay was talking about. When you take away that hope, what are you doing to us? No, we are not a small group of people who are here. You are present, but you represent how many more people back in your communities? We have to educate, we have to share the word, we have to let the fourth, the fifth floor, and let the public know exactly what is important to us as New Mexicans. Senator O'Neill said, yes, we have options. Yes, we do. The legislature is not powerless. We have options to do. But it also comes from you, the people who elect us, to make sure that we have the uproar, that the people understand the power that we have, that we can make a difference. And if she still says no, then we have options.
Yeah.
We have options. And in my time in the legislature over all these years, the big question that is still not being asked is, what about Optum? Where is Optum in this whole thing? That's the question. Optum's role, value, I mean, we've had many conversations about behavioral health. But where is Optum Health in this whole process? What is their role? Are they not supposed to be the oversight? Excuse me, there's even a bigger question on that lack of leadership and what they are not doing to oversee our system. I've heard many pieces of information of that even a year ago, Optum refused and was not even working with some of our behavioral health providers to work with them on guiding and the guidance that you're supposed to give. I haven't seen it in writing, but I trust the people that I'm listening to. They know, they do the work. I don't. But if you have sometimes, as we all know, that begins to grow, people talk about it. These are professionals who are talking. A lack of oversight, a lack of guidance, then who's the ultimate responsible? Optum Health. And who does Optum Health respond to? Well, the governor's office, Human Services Department, it's all part of the administration. Please, go back to your community. Continue to talk, continue to educate. Simple, short, sweet. That is what it takes for us to come. So when we come to the legislature, whether it be in an extraordinary session or we come back in January, we have troops. We have our people with us to stand with us, and we will stand with you to make sure that we take care of our communities. Because God forbid there be an accident. God forbid there be an accident because of the lack of New Mexico's taking, our state government taking the responsibility. Not the providers, but us, because we have that oversight. God forbid there be an accident. Because guess what? I hope they sue us. God bless you, keep the fight up, and you have those of us in elected office to support you. We will stand with you. Let's get the troops out. Thank you.
I'm standing here not as hopeful as some of the other speakers, but because I think people matter, and behavioral health matters, and my child matters. Neil, who's with me today, and I'm so happy that he is, has a diagnosis of paranoid schizophrenia. He was getting his behavioral health services from Hogaris. He no longer has access to a therapist, and we don't really know where his medical record is. So those things are of a concern to our family. I also have concerns as a community member, a person from New Mexico. Some years ago, when we started this transformation grant process, suddenly we were all sitting at the same table. Providers, clients, family members, state partners. It was really an exciting time. And even though New Mexico was dead last in behavioral health spending, first in suicide, first in drug overdose, all those kind of things, we remained hopeful because we thought together we could matter. And I'm here at the Roundhouse and I'm thinking back to those days when we had some division in our community, when we were battling out the forced treatment initiative. And, you know, people from both sides of the issue in behavioral health were here. And the people I were with were against forced treatment, and the administration was supporting the legislation. And I got a call on my cell phone from Pam Hyde, the then Human Services Secretary, saying she was concerned about one of the people who'd come up to oppose her, that person was having a hard time with the process, and Pam was sitting with her, and she wanted me to come over and join them. And that, that was a huge and contentious battle, and we stayed a community. And I'm not feeling that anymore. I feel like our community has been dismantled. We're broken. Our Human Services Department has chosen to minimize and disempower us. And that just feels wrong because their mission is to serve us. We need support, we need outreach. People with mental health disorders and fragile brains, they shouldn't have to prove their services have been interrupted. And that's what I feel is going on. We have to prove that. And that's just wrong. And so right now I am mourning the loss of that trust and that community just as much as I am worried about my child and his access to a therapist and where the heck his medical records are. So I think we do need to hang together. We have to look at each other as being small and mighty, and we need to connect right now. And so thank you for letting me connect with you today. Thanks.
Good morning. I want to thank you all for coming today. The mission of the National Association of Social Workers is to protect against discrimination and to represent vulnerable citizens. For those of you that are involved in the behavioral health field, we know all too well about the principle of bullying. And there's been a lot of discussion as far as our schools. How do we stop the bullying? Well, we've got a classic case with organizational and state administration bullying. And it's going to stop. It's going to stop. When we think about what happened on June 24th, I've worked as a social worker since 1977. I've been a behavioral health provider. I've worked with other colleagues throughout our behavioral health community. I have never seen a more damaging act to our behavioral health services as to the action that was taken on the 24th of bringing in the 15 groups and calling them criminals and fraudsters. Outrageous. What this is all about, and separates those that want to proceed forward in this transition and those that consciously say, no, we need to protect our children and families, is this. It really comes down to this. Do you believe in New Mexico? Do you love your state? Do you believe in its capacity to resolve its own issues? Or do you say, no, we can't manage our own organizations. We can't handle our own behavioral health. We have to send $18 million out of state to let somebody else try to resolve that. I say no. Last week, the Legislative Finance Committee voted 15-1, bipartisan, Republicans and Democrats, imploring our state government, Department of Human Services, stop these payments to Arizona. What was the comment? Actually, even before the committee hearing and the vote, regardless of what the vote is, we're proceeding with the payments. With no explanation, with no rational reasoning as to what this was about, how they were being paid. We do know how, think about these salaries. Think about, if we want to talk about curbing waste, let's look at those payments where we're flying people back and forth at $300 an hour. All of us should be outraged. All of us should be outraged. And I guarantee you, we're going to continue this fight until we get the answers. There's only one way right now to start the healing, and that's to stop the payments to these Arizona providers. Start the healing. Stop the payments. 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 Folks, I don't think the governor anticipated the outcry and the backlash that she is just beginning to see. The fight is on. Thank you.